my name is Kristen. I'm going to be your nurse practitioner, and today I'm going to be doing your physical assessment. Before we begin, I'm going to have you use the restroom and empty your bladder and change into a gown.
Okay.
You need to take your shirt off and your socks off. Once the patient has changed, we're going to do his height and weight and his vital signs and assess his distance vision using a Snellen chart. Your vital signs are all normal. BMI is 24. While he's seated, I'm going to inspect his head and face and palpate for symmetry. Okay. Next, I'm going to palpate his TMJ. Open and close. Okay. Listening for, feeling for any cracks or crepitus or pops. I'm going to assess and palpate his scalp and hair. Noting the texture and the distribution. Next, I'm going to palpate the facial bones and his frontal and maxillary sinuses. Do you have any tenderness?
No.
How about there?
No.
Okay. Next, I'm going to have him clench his jaw and clench his teeth, and wrinkle his forehead, stick his tongue out, puff his cheeks. And this is to assess his cranial nerves 5 and 7. Just go ahead and stick your tongue out. Can you show me your teeth? Smile without showing me your teeth. Puff your cheeks. Wrinkle your forehead. And close your eyes really tightly. Okay. And next I'm going to assess sensation, cranial nerve 5 with a cotton ball. Now you close your eyes. Tell me when you can feel me touching.
No. 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 No.
Next, I'm going to assess his eyes. So first I'm going to begin with just the general inspection of the lids, brows, sclera, and conjunctiva. His sclera are white. Okay. Next I'm going to palpate his lacrimal gland. I would put gloves on for this. And I'm going to check if his pupils are equal and reactive to light and accommodation. Okay. And I want you to follow my finger. Okay. Then also I'm going to check the corneal light reflex by shining the light. And the light shines equally, reflects equally on both cornea. And we could also do the Rosenbaum, which is near distance. So I'm going to have you cover your eye, one eye with this. I want you to read off of this the smallest line that you can. Okay. We're pretending because this is blank. And now I'm going to have you switch eyes. And same thing. Read the smallest line that you can. Thank you. Okay. And next we're going to check his extraocular eye movements. So I want you to follow my finger. Okay. Same on this side. Now we're going to assess his visual fields. And have you cover one eye. Okay. And tell me when you can see my fingers.
Oh.
Okay. Cover the other eye. Same thing.
No.
Okay. Alright. And now we're going to move to the ears. I'm going to begin by just a general inspection, looking at the surface characteristics, looking for symmetry. Next I'm going to perform the whisper test. So I'm going to stand behind the patient and have him occlude one ear. So go ahead and occlude your right ear. And then I'm going to whisper 2 words to him and ask him to repeat those to me.
Hot dog sports car.
Okay, and I would repeat the same thing on the other side. I'm going to inspect the inside of his ears with an otoscope, which I'm going to use a flashlight to pretend. Pull up on his ear and look at the external auditory canal and the tympanic membrane, and do the same thing on the other side. Next, I'm going to do the Weber and Rinna test. I'm going to use a regular fork as my tuning fork. Strike it, place it on the top of the patient's head. Tell me, can you hear this equally in both sides or more on one or the other?
Equal on both sides.
Okay, and strike it again. Place it to the mastoid bone. Tell me when you can't hear it.
No.
Okay, and tell me when you can't hear it.
No.
The air conduction should be twice as long as bone conduction. Next, I'm going to move to the nose. So I'm going to do a general inspection, looking at the septum, and then I'm going to have him occlude one side of his nares. Take a deep breath. Okay. And the other side. Okay. Next, I'm going to use the nasal speculum, and I'm going to inspect inside the nose, looking at the septum and the turbinates and the nasal mucosa. Next, I'm going to move to the mouth. For this, I'm going to put gloves on. I'm going to inspect his lips, the mucosa, his teeth, open them up, his tongue. And then I'm going to grab my tongue depressor. I'm going to have the patient open his mouth, say ah. Okay, and I'm also going to check his gag reflex. Okay. Alright, next I'm going to check the lymph nodes. So I'm going to begin with the preauricular, posterior auricular, occipital, and then here the tonsillar, submaxillary, submental, the superficial cervical, interior, deep cervical, posterior cervical, and supraclavicular. You can have the patient bear down like a Valsalva maneuver. It helps in assessing the supraclavicular lymph nodes. Next I'm going to assess the thyroid and his trachea. So I'm looking at it to begin. And I'm going to palpate it. Okay. Swallow. Swallow. Okay. I'm going to check his range of motion, having him bring his chin to his chest and then tilt it back. To your right, to your left, and back to center, and now twist your head side to side. Okay, and we're going to do the same thing against the resistance of my hand. Okay, 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 and twist. Okay, and then I'm also going to check his shoulder shrug against my hands. Next I'm going to check his carotids one at a time. On the other side. And then we're going to listen over the carotid arteries with the bell. And then also, if the thyroid was enlarged, we would listen over that for bruits. Okay. Next we're going to move to the upper extremities. I'm going to begin with the general inspection, just noting the color of the skin, the temperature, any edema, and his muscle mass and strength. Then I'm going to check his pulses, beginning with the brachial, and radial. I'm also going to assess for epitrochlear lymph nodes. Okay. Now I'm going to move to assessing his back. So I'm going to have you turn away from me on the stool. I'm going to begin with the general inspection of the spine, looking at its curvature. I'm also going to look at it from this side. And then I'm going to palpate the spine for tenderness. Okay, I'm also going to palpate the scapula. Okay, and next I'm going to percuss the spine. Let me know if this causes any tenderness. Okay, I'm going to place my thumbs at the 10th rib and watch thoracic expansion. Ensure it's symmetric. Okay. I'm going to percuss for kidney tenderness. And next I'm going to assess for tactile firmness. I'm going to have you say 99 each time I place my hands on you.
99, 99, 99, 99.
Okay. Next I'm going to percuss the posterior and lateral chest walls. And you raise your arms up above your head, and I will percuss on the side. Okay, arms back down. Now I'm going to percuss for diaphragmatic excursion. I'll need a pen. Okay, I'm going to have you take a deep breath in and hold, and keep it till I tell you to let it out. Okay. I'm going to percuss. Till I hear the dullness, make a mark. Let it out. And then back up. Make a mark. And I'm going to measure that with my 4 centimeters. And then I'm going to do the same thing on the other side. Deep breath in. Let it out. noting that the line is higher on the right side than on the left side. Okay. Now I'm going to auscultate his breath sounds. Okay. Now I'm going to move to the anterior chest, so I'm going to turn back forward. I'm going to begin again with a general inspection. So looking at the chest expansion. Okay. And then I'm going to palpate the chest. And I'm going to assess the precordium. Okay. And assess for the point of maximal impulse. I'm going to auscultate lung sounds and heart sounds. My heart sounds: aortic, pulmonic, second pulmonic, tricuspid, and mitral. And to assess his lymph nodes, so we have the subclavian and the central axillary, brachial, and axial. This time I'm going to have the patient lay down. And I'm going to assess his chest. I'm looking for any heaves or pulsations. And I'm going to percuss for resonance. I'm going to listen to his lung sounds again. Or heart sounds, I'm sorry. Aortic, pulmonic, second pulmonic, tricuspid, and mitral. I'm going to move to the abdominal system. So again, I'm doing a general inspection. Going to auscultate. going to percuss, measure the, beginning with the size of the liver. And measure. It's 7 centimeters, which is normal. I'm also going to percuss on the left side, mid-axillary, to assess for the spleen. Next, I'm going to begin with light palpation and then move to deep palpation. Next, I'm going to palpate specific organs. So we begin with the liver. Okay. And spleen. Okay. And I'm going to lift the patient from the back and attempt to feel his kidneys. Same on the other side. And have the patient lay on his left side so I can auscultate specific heart sounds. Okay, and you can move back to your back. Okay. And next I'm going to listen with the bell of my stethoscope over the aorta and the iliac, renal, and femoral arteries, listening for any bruits or venous hums. Next, I'm going to palpate the inguinal area, assessing for inguinal lymph nodes and the femoral pulse. Okay. And the patient sit back up. Sit on the stool. Next, I'm going to assess his lower extremities. So, we look and check the temperature, color, the texture of the skin. I'm going to assess for any edema. I'm going to palpate his popliteal, pedal, and posterior tibial pulses. And next I'm going to have him demonstrate range of motion. Okay. Can have you lay back down so we can check your range of motion of your knees and hips. Okay. Can you bring both your knees together and back down? Okay. And then one knee bend it up, leave the other one down, and back down. Now swing your right leg out, and back across your body, and back down. Bend that knee up. Place your foot on the bed. Now rotate that knee in and out. And place your ankle on your knee like you're crossing your legs. And let that knee fall down. Okay. And then back out. And put your leg back down. You can repeat that on the other side. We're kind of limited to the couch. Okay. Now we have the seat back up here. I'm going to check his deep tendon reflexes. So this is going to be my makeshift hammer. First, it doesn't work that good. And then I would support the foot while I check the Achilles reflex. And I'll support his arm. I'll check the brachial. And then, of course, triceps. Also going to check the range of motion of his shoulders. Okay. Your elbows, wrists. Okay. I'm going to have him stand and check the range of motion of his spine. Bend forward. Bend backward. To your right. To your left. Okay. I see. I'm going to check some neurologic function. So we're going to do sharp and dull sensation. You should close your eyes. Tell me if you feel sharp or dull.
Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Dull. Dull.
Okay. Next I'm going to check his sensation to vibration. So I want you to tell me what you feel and where you feel it with your eyes closed.
Vibrating left wrist.
Okay.
Vibrating left ankle.
Okay. And also going to check his plantar reflex. So I'm going to take my spoon into the bottom of his foot. I'm also going to have you touch each of your fingers to your thumb. Okay. Close your eyes. Put your arms out to your sides. Okay. Finger to your nose. And the other one. Switch. Switch. Okay. You should do that as fast as you can. Okay. Alright, now I want you to touch your finger to your nose and then to my finger. Hands down. Touch your finger to your nose, to my finger, to your nose, to my finger, to your nose, to my finger, to your nose, to my finger,